Hey everybody, this is Rob Archangel and I'm back, and today I want to talk a little bit about the definitive testosterone replacement therapy manual and offer another review. I've got a copy of it right here. It's written by Campbell. And in the interest of full disclosure, I will mention that Archangel Inc. did actually help to publish this book, and Jay has become a friend over the last couple of years. That said, I am not just shilling for it. You don't have to pay a thing for it. If you're interested in the book, you can get it completely free at trtrevolution.com/PDF. You can also get a paperback edition of the book for the cost of the shipping and handling, also at trtrevolution.com, so feel free to check that out. So let's talk a little bit about what TRT is and about this book. Now, TRT is, as it sounds like, replacing the testosterone that your body would be producing naturally, and it's a medical practice for men who are experiencing both the lab and clinical values of low testosterone. As men, testosterone has an effect on all sorts of processes in our body, not just our libido and sexual health, and not just in our ability to put on lean tissue, but also things like our overall sense of mental health and well-being. Depression is often linked with lower testosterone levels, mental fog, poor sleep, and so forth. And so, optimizing your testosterone levels, getting it back into the healthy physiological range so that you experience overall sense of vitality and good health and well-being is the goal of TRT. And so Jay talks a little bit about that. He gives you some resources for different questionnaires to figure out if you might be a candidate, gives you some resources on where you can go to get tested, gives you some advice about the various options that you might have for TRT, for injectable versus non-injectable options, the pros and cons of each, what sort of protocol he uses and he's seen other men benefit from. He researches and describes in really extensive detail a lot of the most current research around TRT and its how to use it safely and effectively. So TRT is something that is not as common in medical practice these days, although it's becoming increasingly more so. And so it can be really hard for a lot of men to figure out what the best approach to take is if they are, in fact, a good candidate for TRT. There are also a lot of programs and doctors out there who don't necessarily know what they're doing. And there's a good chance that if you are using a poor protocol, that you might experience even more consequences, even more side effects than you were looking for, outside of and beyond simply experiencing the symptoms of low testosterone. Messing with our hormonal system, our endocrine system, can be really tricky, and you want to make sure that you know what you're doing and following the best protocols possible under proper medical supervision. In terms of the book, a couple of things I think that are really well done. I mentioned already that it's extensively documented. If you are science-minded and interested in reading the primary sources, there are lots and lots of them that he provides. And in terms of his writing style, he is engaging and created this really as a manual. It's not something you necessarily have to read from start to finish. This isn't a novel. You can bounce around from chapter to chapter depending on what you're interested in, and you can use it as a research guide later if you are going back trying to learn some more information, learn about the differences between different protocols, different administration methods. You can learn about the different approaches to exercise and diet that he discusses. All of these are things that you can go back and reference. He includes lots of sidebars, lots of graphs, lots of comparisons between different compounds and adjunct medications that might be of value to you if you're a TRT patient. And overall, I think it's a well done book. I know Jay spent a number of years putting it together. He has been a patient under medical care for a decade and a half or so, and is a really bright guy. I really like him. He's thoughtful. He knows his stuff, and I think he presents a compelling and strong case for what he advocates and for all men who might be experiencing anything that is potentially testosterone related, to at least follow up, to arm yourself with some information and knowledge so that you can determine if this might be a good fit for you and what resources you have at your disposal so you can pursue proper medical care. So again, this is the Definitive Testosterone Replacement Therapy Manual, written by Jay Campbell. Thank you so much, Jay. I wish you all the best, and you're doing great work on behalf of men and men's health.